All right, we're going to go ahead and get started, and hopefully our second speaker will be able to join us. Thanks, Emily. All right, so thank you for joining us today for our community stakeholder meeting. We have a great agenda for you today. Just for an accessibility check-in, we want to make sure we remind you to, if you're going to be speaking, to say your name when you speak, that you talk directly into the microphone. If you're to be presenting or you have a question, we have closed captioning that I will place in the chat in a moment. And if you have any questions regarding any component or you need anything defined, don't hesitate to put that in the chat as well, and we'll try our very best to answer those questions. And we will do our very best to speak clearly. These were for our speakers. We sent these ahead of time. And then as an introduction, my name is Natalie. I'm with DMAS. I am an African-American female with curly hair, and I'm wearing a brown undershirt and a brown sweater today. And I'm happy to be here with you all. All right, so our agenda for today, we're going to talk about the impact of our members and highlight our member advisory committee. We have a couple of committee members that will be joining us in order to talk about their experience on the committee and to give you a push to encourage your members to join. And then we're going to also focus on those who are providers and still would like to offer feedback or join an opportunity for you to hear more about those resources and tools that support you. We're going to have Tia Lewis on to talk about our provider focus group. And then we're going to highlight our community stakeholder partner, La Casa de Salud, and they do tremendous work with our community, with our Hispanic community, and they're going to talk a little bit about what that looks like for them. Then we're going to wrap up and take any questions that you may have. All right, so if you can drop in the chat. You've been chosen, your name, your organization, you've been chosen to represent your country in the 2028 Olympics in Los Angeles, because they're going to be stateside. What sport or activity are you doing and why? And I will say, after watching the Olympics, the sport that I felt as if I would love to try and embodied a little bit of my personality was fencing. Me and my nephews really loved fencing. It was such an interesting and invigorating sport. And then also they were passionate in ways I didn't think, like, it was so interesting. So anyway, for me, it would be fencing. So if you want to just drop in the chat what that would look like for you, please do. And I'm sorry, I have some allergies and we're going to try to get through these things. I'm still missing one of our members, so hopefully they can hop on at some point. And I'll see if they need to be elevated in a second. All right, so the impact of our members. Today, we're going to really kind of talk through what the MAC looks like, how it came to be, then hear from a couple of our members about MAC role responsibilities, as well as what that experience looks like for them and why it's really important that we encourage our members to participate, or authorized representatives to participate in that process. So the purpose of this committee was to make sure that our members and authorized representatives are able to share their lived experience, any observations and recommendations that they have for the agency. We really encourage them, as they are appointed to the committee, to participate fully in the discussions, in the work, any resources that we need to turn over. We encourage them to participate fully along the way, so that as we get to those any challenges or those things that we're doing exceptionally well, that they're able to let us know ahead of time, or let us know while we're doing it, so we can provide that feedback back to those team members and staff, as well as our executive leadership as we go along. We encourage our members to offer up those recommendations in a way that feels most comfortable for them in the setting. They can have an open discussion, they can provide it in writing. We'll often discuss it in other meetings that we have. And so all of these components are really there to make sure that those recommendations that they provide directly to our agency director, her leadership team, and the staff and state board that subsequently support the vision and work here at DMAS, that our members have a centered opportunity to share their voice, their recommendations. So how did this start? Colorado was the very first state to have a statewide advisory committee that was solely made up of recipients. And for us, we were the second state in in the US to do this. It was established in 2018, and the first meeting was actually held in 2019. I was not a part of the DMAS team at that time, but it was led by the division director over at Appeals. And if any of you know John, he worked with Deputy Hatton. I don't know if that was Deputy Hatton at the time, but anyway, worked with Deputy Hatton in order to make sure we're able to stand up this committee. And the committee, as I shared before, and the purpose is to make sure that they are providing recommendations around development communication services, programmatic opportunities, navigating the entire component of the work. They're able to share those ideas and come back and give feedback regarding those things. Our Deputy Director of Administration and Coverage serves as an ex officio member of that committee, and right now that is Sarah Hatton. And I said that it started in Appeals, and we were the second state after Colorado to do this. And we talked with Colorado, from what I understand, from a historical standpoint, a good bit about what that looks like, some of the things that they felt like they were doing really well, and then some of the things they would adjust. And we had to make sure that it fit the need that existed within the Commonwealth of Virginia. So our committee member who was supposed to take on this slide look like she just dropped off. So I'm going to see if I can come back to this slide for her. I'm going to ask in a second, like, where is she? And hopefully she can come back. She was having sound issues. I will come back to that. So are there prerequisites to becoming a MAC member? We'll come back to her slide. No, the only requirement is that a member is a current member and they have a willingness to serve and share their observations and their experiences with the agency, and that they're able to, communicate clearly about what those recommendations look like in order to improve services all around. Those are the only things: a willingness in to serve and be able to truly articulate their recommendations. We do this because we know that members can sometimes be hesitant about serving in spaces where they may not always feel as if their voices are valued or heard. And I think our agency does a great job of trying to center and elevate those things. And so for us, having these very simplified qualifications allow for them to know that there's space for them, and we encourage for them to serve in this manner. So our current committee composition looks like this. We try our very best as we're going through recruitment seasons, which is year-round for us, to mirror our members or those who are serving on the MAC with the overall complex demographic of our total membership within the Commonwealth. Right now, this is the breakdown of what it looks like, and we're going to be adding what that A category diversity looks like in the future, so that we can make sure that it's truly representative, to the best of our ability anyway, of the members that receive services within our state. We're always encouraging every member, no matter where they sit on the continuum of support and care, to apply to be a part of our MAC committee, because we know that it's a wonderful opportunity. And for those who have served, they have shared that it has been a wonderful opportunity. So this is the pack that was created in partnership with members at the inception of the MAC. It is really just about what expectations are there to be had as we come and interact together, and then the things that can be done as we move forward, and from an agency perspective, and for a stakeholders perspective, what can we do? And it talks about being mindful, participating, collaborating, making sure that you leave space for future discussion. We also want to make sure that people's voices are heard, that that we consider the breadth and depth of their experience, that we approach any challenges that may exist in a solution-focused manner and with solution-focused energy. All of these things come together in order to make sure that the process and the engagement that takes place is collaborative and synergistic from a member standpoint, from our agency director standpoint, from a leadership standpoint, and actually at this point from a CMS standpoint, because now it is a requirement of CMS to have this body exist within the Medicaid sphere of support. So we want to make sure that all of these things, as we can to the best of our ability, are accomplished so that everybody feels valued and heard. So our two members, one is trying to reconnect because she had sound issues, and the other, I'm not quite sure if they're going to be joining. I'm going to check right quick to see if I see any of them in the Sonia. Do you see a Brian Roche in the participants? If so, could you elevate him to a panelist? And if you see Sheila, if you could do the same, I would greatly appreciate it while I'm sharing the screen so I don't have to stop sharing in order to see that. We're going to keep going and we'll come back as soon as I see them pop up, and they can give you a little bit more about their experience. So the committee structure and meeting. So the committee is supported by the outreach and member engagement team in the eligibility policy and outreach division under the Deputy of Administration and Coverage. We meet quarterly, 4 times a year, and those are the months we're going to be meeting in. And this only shifts or changes if we're given direction by our administration to do so. We accept applications year-round, and we hope that as we're going out and engaging with members, or as our team members or the staff is going out and engaging with members, that they're able to also offer the opportunity for them to apply to be a part of this wonderful committee. Orientation for the committee, we typically do. The other name is Sheila Johnson. Sonia, thank you. And if you see Tia Lewis as well, if you can escalate her as a panelist, I will greatly appreciate it. Tia, thank you. The orientation is held at the very first meeting, and we go through all of the just standard things that go on as within the MAG, how it affects the MAG, how we encourage them to participate in all of those components. We send out a meeting agenda and minutes, presentations, and we post the agenda and things back to Virginia Town Hall and on the DMAS website within 2 to 3 weeks after the meeting, so everybody has the resources and tools that were shared during the meeting. So this is for us just an open call for you to truly please encourage your members to apply now. We're going to have a number of seats opening at the end of this year. We rotate members on and off. They will be going into a 2-year term, and so we have quite a number of seats that we're going to be filling to start in 2025. So we would love any and all of our members and authorized representatives to throw their hands in the hat to be considered. If you're interested in pulling down the application, this QR code will take you straight to it. If you want to take a picture of this screen, we also have it on our website and the follow-up resources that we hopefully, once we get our technical issues worked out, be able to send out. We'll be able to share these things with you and further encourage you to share with within your agency, amongst its staff, and anybody that works tangentially or directly with our members. So for us, it's been really important and really encouraging to see what this engagement has yielded. Communication regarding certain components of our services have been enhanced because our members have been able to provide feedback on different components, resources, and tools, creating more clarifying language, improving our website navigation, making sure that the guidance that we sent out even during COVID had clarity. I talked about the materials for them to ask really challenging questions of the agency and of partners along that continuum of support and care in order to improve the overall experience and services that are received by our members, and really better navigate those challenges and understand how they can communicate about what that navigation looks like so that we can improve how we do the work that we do on behalf of our members. And there have been, based on the experiences that Colorado, Virginia, and a couple of other states have shown, now CMS definitely values and we have demonstrated the need to have this aspect, this voice, this lived experience centered. And so now every state, per the ruling that came out in April, is required to have an advisory committee, and it's called a beneficiary advisory committee, along with their medical advisory committee. This MAC is in its 5th year. We offer a lot of technical assistance to other states regarding any questions that they have about the development of the committee. In 2024, during our recruitment season, we were able to pull down 400 applications, and we're hoping to continue that that wave of bringing in people. A lot of our past members have gone on to lead in different ways through other state agency committees or in other ways as far as in their community around championing the lived experience and voices of our members in their need to be a part of certain discussions. We've also had feedback that have been migrated through the agency in order to change some of the things that we do. We fostered a lot of champions and ambassadors through the membership that have come through. And then again, the integration with the provider focused component of what CMS requires is to be happening over the next 3 years, but it's to start this year, well, by 2025. So these are the websites that you can go to learn a little bit more about MAC. And we encourage you to peruse it to your heart's content, pull down as much information as possible. And if you have any questions, don't hesitate to shoot them our way. And you can shoot them to mac@dmas.virginia.gov or covervirginia@dmas.virginia.gov. So I'll pause here, and I know I'll see if any challenges are still ahead with our members. Okay, so Brian is on the phone, Sonia. So are there more than one phone call in? If not, then if you can escalate the phone, and I'm assuming that the phone number is, let me go back, last 4 digits 6917. If you can promote that person or allow them to speak, we can go back and allow him to share his experience on the MAC. Oh, they may not. Well, for right now, we'll see if that happens. We'll come back around to him as soon as we're able to elevate him up to a panelist. All right, let's keep rolling. So next you will hear from Tia Lewis, and she'll be talking about our provider focus group and what that means for those who are working directly with our members and how can they engage and learn more. Can you hear? Oh, Brian, is that you?
Yes, it is. I'm so sorry.
That's okay. I'm so happy we were able to get you in. So I'm going to go back really quickly. If you could take the next minute or so and just talk about your experience on the MAC and why it's important for others to take advantage of participating if they can.
Well, my experience on the MAC has been quite enjoyable. In my opinion, I get to learn about other individuals' perspectives from, the people that kind of run the departments to the individuals who use Medicaid. Me, myself, I'm a Medicaid user myself. But one of my reasons for joining the MAC team was I simply wanted to make some changes with a particular provision of the Medicaid rules, that I find, I know why it's there, but I find it to be a little inequitable. So my goal as to why I joined is to kind of not necessarily change it, but find a better way that kind of is equitable for individuals who are disabled and or poor. It's just that provision, kind of motivated me to kind of join, and not to mention I get to make a little more difference for people, with my particular type of disability, which is blindness and cerebral palsy, when it comes to making things more accessible with, Medicaid, because I'm certainly sure while Medicaid does benefit the poor and vulnerable communities such as mine, they don't necessarily think much about it. Not like it's their fault, but, they don't walk in our shoes. So, we tend to bring perspectives to them that make them say, really, I never really thought about it that way. That's my reason.
Well, thank you so much. Please stick around just in case anybody has any questions towards the end. But we always love to hear directly from our members regarding what their experience has been like on the MAC, but why it's also important for others to seek out the opportunity to serve. So again, thank you so much for coming and providing, lending us a little bit of your time. And then hopefully if we have any questions for you, they'll be towards the end. So please stick around.
Okay, that's fine.
Thanks. All right, so we'll come back as soon as we get Sheila back on. But we're going to move on to Tia, and then Tia could, and just let me know when to advance the slides, Tia.
Okay, thank you, Natalie. Thank you for all of the great work that your team does with the MAC and with ensuring that Medicaid members have a voice. Because I'm kind of on the other side. What I'll be talking about today is ensuring that the providers have a voice. But I want to say that one can't operate without the other. So it's important for the members to hear this presentation as well. because obviously if you have any feedback that you want to share with me directly on things that you feel will be beneficial for our provider group to hear, I'm very open to that feedback and would be sure to include it in a future agenda. So I'll start out by saying my name is Tia Lewis. I am the Division Director for Program Operations in DMAS. My division oversees some of our higher contracts, things that you, as a provider, probably deal with directly or have billed directly, non-emergency medical transportation, provider services, service authorization. We also own the mass mailing population, and we cater to the fee-for-service delivery system. So next slide, please, Natalie. Although my agenda is brief, my message is very important. I'm going to talk about the introduction and purpose. I'm going to give you some examples of what we actually talk about in the provider focus group, give you information on when our next meeting, which is coming up very quickly, and then I'll be happy to address any questions that you have. Next slide, Natalie. Thank you. So the introduction and purpose. Without telling my age and giving away too much information, I've been around for quite a long time. So this group has kind of shown itself in many different forms. In the past, I think it was more of a question answer type of call, and we desperately worked on issues that the providers gave us. We've sort of expanded that group to now we meet monthly. We take agenda items and we go through any major updates from an agency perspective. We focus on billing, provider enrollment, any new initiatives. So really the introduction and purpose is to give providers a voice, to also provide important updates that you may need from the provider perspective, and also allow a platform that providers can share directly with internal DMAS staff as well as contractors and vendors regarding things that they may be having challenges with, or in some instances, things that they think are great and that you want to see more of. Next slide, please. So example of agenda topics, just to kind of help you understand the things that we talk about in these meetings. On a monthly basis, we talk about claim denials, which is important from a provider perspective, because, you know, obviously you need to know what things that we're receiving denials on. I have to be honest and tell you it's kind of different for providers to hear about claim denials because many large provider groups use billing entities. So sometimes you're hear from the first time what our list of denials are and where the problem points are. But the problem points and exposing those helps us both work together as a team, because maybe you're receiving denials because there's an issue, a system issue, or something wasn't rolled out appropriately. Then that gives internal DMAS staff an opportunity to address those issues. And then it just may be simply something that you weren't aware of that you could be doing in your office, such as one of our main denials that we get is for not billing the managed care entity, which all goes back to checking eligibility. We also talk about behavioral health updates, which we have a lot of great things happening right now with behavioral health. A lot of programs are expanding, and that gives us a kind of an opportunity to address those issues directly and give you an opportunity to ask us detailed questions about those new initiatives. We also query providers directly for suggested topics. We talk about upcoming implementations. I can say as recent implementation in November of 23, my team implemented the service authorization new contract, which included behavioral health and medical service authorizations, where in the past it was simply medical service authorization. So that was a huge change. We discussed billing issues and best practices on how to bill and receive prompt payment from the provider perspective. We talk about provider news, and we definitely spend a lot of time talking about our Medicaid enterprise system, which is a provider. You understand that that's been a huge initiative for the agency, from going from one sort of catered solution to modularity, where we have multiple solutions that kind of have to feed into one another and talk to each other. Next slide, please. So next focus group, I promise you, is coming up. It's Monday. Still not too late. If you are currently a provider and you wish to attend our focus group, please reach out. I've included the email address and we'll get you that agenda. We have many of the topics that I've just listed on the focus group agenda for Monday, as well as some additional things, kind of one-offs that got added. We normally have on average around 200 people that actually attend. There's probably 400 invites that go out. So we have large hospital groups. We have a lot of smaller providers. There's an opportunity at the end where we cater directly to the CSB groups who sometimes have a lot of initiatives that require detailed discussion. So if you are a provider, I would very much like you to attend this group. If you are a member or if you're part of the MAC, I really would like to hear any feedback on any items that you think are important that I include as talking points in this group. And that was short and simple. And my last slide is simply to remind you of the email. So does anyone have any questions at this time?
Let me see. Let me see if I can expand so I can see any.
I don't see any, and that's okay if you are shy right now at the moment. Just send us an email to the provider focus group, even if it's just a question, and I'll be happy to address your concern. Thank you.
Thank you so much, Tia. If you don't mind staying on, just in case we have a question that pops up in the chat or from another attendee, I would greatly appreciate it. All right, we're going to keep rolling. And the next presentation, now, Sheila said she's in the meeting, Sonia, but she says she can hear, but I can't see all of the participants. So if you don't see a Sheila Johnson or the phone number that I sent you, then we'll keep rolling. Maybe Sheila, if you can drop in the chat who you are, then Sonia can pick up on how your profile in the system is picking up if we don't see your phone number. All right, we're going to go on to our next presenter, and then we're going to try to get Sheila at the end. All right, so sorry about that. All right, next we have Dr. Antonio Villa-Paez, and he's going to be talking about a wonderful resource that we have within, Sonia, you guys are wonderful, in the community. And so, Sonia, I'm not Sonia, Sheila, can you speak?
Can you hear me?
Yes, we can hear you. Okay, I'm gonna go back. I apologize, everyone. So we can hear from Sheila, and she's going to talk really quickly about her experience on the MAC, and why it's important. So go for it, Sheila.
Okay, good morning, everyone. Sorry for all the delay. I found out about the MAC through an email, and then that's when I decided to get involved. I am the caregiver for, as I call him, my BBE, which is the best brother ever. And I wanted to have more input or see how the system works because he has been involved in the system for over 20 years. So that was my reason for wanting to do that. What I found so valuable so far in being on the MAC committee is just the opportunity to engage with other people who have similar experiences that we have also, because nobody can really understand what I'm talking about most times. But what I found valuable was all the interconnected pieces and the committees and the departments, and just the willingness to assist us and others during this process. So that's what I have found valuable. And like I said, just meeting other people and just getting to share our lived experiences.
Well, thank you so much, Sheila. I'm so happy we were able to figure out those technical issues so that that you can share today. Please stay on with maybe some additional questions regarding your experience or any advice you may be having for anyone that is looking or is interested in serving on the MAC. So we're going to head on over to our last presentation for the day and hear from our community partner that is doing tremendous work in the Hispanic community. So take it away. Antonio, are you there? We can't hear you. Hello? Can't hear you. So let me see, are you still muted? Let me see. I don't see him. Sonia, do you see him? I see him as a panelist, but hello? Dr. Vea? All right, I guess he's going through a couple of technical issues. If you can hear my voice, go ahead and log in via phone. Sonia will definitely share that phone number with you. I can't hear him. He can hear slides, but can't hear. He can see the slides, but cannot hear. Okay, I would suggest he logs out and come back in. Is that correct, Sonia? I promise you, we practiced at the beginning. We could hear him at the beginning of the thing. Hello? All right, well, we're gonna pause here until he's able to come back in and hear us. And we're gonna open up the floor to see if there's any questions from the audience regarding any of the speakers thus far. And let me pull up the chat so I can see if there's any questions. I think he signed off and he's gonna come back. Okay. All right. Well, I have a question for Tia. Thus far, when your providers want to engage in the provider focus group, what are some of the things that you ask them to bring to the table when they're wanting to both learn from the agency and provide feedback?
Normally when they reach out to me, Natalie, it's pretty simple. They'll normally reach out 9 times out of 10 is regarding something we've recently implemented and maybe they're not clear. And so honestly, not a heavy lift for the provider themselves. The lift is on DMAS, which is the way it should be. If you reach out with a question or an issue via the email, then we will work internally to get you the best resources and tools to provide the support or education as a provider that you need in order to make that process more seamless. We have had instances where providers reach out to us directly because they just want to share things like best practices. Always open. We welcome that feedback. You as the provider are the one having to engage directly with us, and sometimes it helps us to have the provider show us from the other lens what their obstacles are, because sometimes it can be difficult internally when we roll out different programs or initiatives or new systems to understand how it, directly it's affecting or working for the provider. So we recently did like a whole walkthrough with a provider stakeholder group. They provided us some feedback on one of our portals, and we were able to successfully make some very needed upgrades to help providers navigate the process a little bit better. So it's not a heavy lift for the provider. Thank you for bringing up that point. Don't feel overwhelmed or that DMAS is going to require anything of you. We'll take on the onus of providing you with the resources and support you need from our level.
Thank you so much, Tia. I think that's tremendously helpful, especially when you have so many of our stakeholders who deal with both our members and providers, to give them some direction about what to do when they want to learn more, as well as when they want to provide feedback. I see, yay, Dr. Vey is back. He can hear us now. And I'm going to turn it over to you.
Thank you. Good morning. I'm sorry for the interruption. I don't know what is happening with the internet or the connection. But good morning, everyone. I appreciate very much this invitation because this topic for us have been very critical when we face help people in the community. So thank you for this invitation. I think you said I have to start with my name. Natalie, that's correct? Are you listening to me?
Look, now I was on mute. I said, we've already shared your name. You are happy to share. You are welcome to share anything about your feedback, and you can just jump right into the slideshow when you're ready.
Okay, thank you. Well, thank you again for this invitation. My name is Antonio Villa. I am a foreign physician from Colombia. I am in Virginia. I have been here for 20 years. I accomplished also an MPH at VCU in 2013. So you can start with the slides. I know that the time is gold for you today. Thank you for having us here to share what we do at La Casa de la Salud and what we have been doing for the Medicaid enrollment and other partners together. So I'm going to share a little about the services and programs that we have at La Casa de la Salud and our program too, our motto, La Casa de la Salud. Next, please. Thank you. La Casa de la Salud was my capstone project in the 2013. Again, when I was at VCU to accomplish my MPH. In that capstone project, we identified for need assessment in this area those top 4 needs for the Hispanic community. As you see, language, support, information, navigation in the health system, and clinical preventive services and health services in general. So by the middle of the 2014, we launched that La Casa as initiative with 4 community health workers, just doing different activities in the community, contacting other organizations that need language, basically help or resources that they want to share in the community. Specifically, we health department, as well the American Heart Association. By the 2022, we have 30 community health workers. 16 of them, we help them to be able to be certified by that time. Actually, this is the largest community health worker program in Virginia. Next, please. Our mission is to contribute to the health improvement of health and well-being of the Hispanic community through a holistic model that promotes healthy lifestyle, facilitate access to health services and other resources. Next, please. We have here our focus areas. We provide health information and health education to the Hispanic community, especially those times that is very critical health information with all the misinformation that we have. We support that with scientific information and other type of information that the community needs. We provide health education in individuals, in events, in the community, as well as workshop. Workshop focus on chronic disease. As you see in the right side, case management and navigation. That's part of what we do while we are doing health education on workshop, but at the same time, case management and navigation for a specific project. As we know, COVID-19 was a very critical time for all of us. But since that time, we have been supporting other organizations and in general, the community and those social needs and connecting them with the resources. For the leadership and primary care, public health, we have been working with different partners, primary care and public health programs, supporting them with training, how to provide cultural appropriate services to our community. So we support partners, we support organizations that have those difficulty to reach out our community. And we have also been participating in different community at the state level and other organizations to support them, and again with cultural appropriate support. Next, please. We have different channels of communication to address the needs of our community. Many times we are working with different organizations. Radio program, Facebook Live have been very helpful for us and for the other partners to share information, to provide education in different topics. And of course, Medicaid have been one of those topics that have a very high view that we see. We intensify all those activities when some of our partners need that. We also reach out to our community through WhatsApp, leaders group that we have. We have information in our website. We use social media, and again, Facebook, to provide information and some resources to our community. We have a phone line that we receive call from our community for any services that they need or guidance for them or resources that they need. And the last you see in the bottom is influential message. Influential messenger have been one of the strategy that we have been expanding our activities in the community. Next, please. This is influential messenger training. Influential messenger are people from the community who want to help others. It can be a friend, it can be in their business, and you probably don't see the big list there at the categories that we have for those influential messengers. We have more than 150 individuals in the community. They have their own business, they have any activity where they have encounters with people from the community, and they help them. They help them providing information and connecting them with us to find the resources that they need. Next, please. We have been working with DMAS through other partners. to enroll individuals from the community. The Latino community, as you know, is the largest community without health insurance, and they have a difficulty, as you see probably in the challenges that you see below there. But we have been providing information through radio programs, through Facebook Live with some partners, as you see there, just providing update information, specific need or expansion or coverage that the program has, especially the dynamic and again after the pandemic. The challenges that you see there are information, difficulty for the enrollment, cancellation, qualification. All those have been questions or support that our community or individual needs in the community. Next, please. We have been working in collaboration with different partners. Today, more than ever, we all understand that the need to collaborate, to coordinate action. So we have collaboration in the community, as you see that list, with Latin American consulate, churches, community health worker, volunteer, as I mentioned, influential messengers, and other leaders in the community. We have different partnerships with organizations. As you see the list in the right side, those partnerships are clinic, educational department, DCU, that we have different other Latinos service organization that provide service to our community. We have education, we have research activities based on the community that we are doing with BCU specifically, with some department. Our funders, you see there, the health department, the BDH, have been a good support specifically for chronic disease. The CDC foundations, we have 4 years working with them, specifically for flu and COVID-19. Local foundation, Georgetown University program, the Institute for Public Health Innovation, is some of our funders to support our programs. Next, please. Well, that's a very short presentation, just due to the time that we have here today, but any questions or any need that you have about our services, you can contact us. But at this time, I am open for any question that you may have. Thank you.
Thank you so much, Dr. Valeria. Are there any questions at this time? All right. If there are no questions, then we thank you so much for being with us today. We thank you for taking the time to hear from our members, to hear about a provider group, to also understand why our members are so important, why it's so important for all of us to stay engaged in providing feedback where necessary. If you have any questions for us, or you would like to provide any further recommendations for future presentations, please do not hesitate to contact us. And we thank you for your time today.